All right. There comes a time in every woman's life when she may consider hormone replacement therapy. What exactly is it, though, and what are the risks and benefits involved? Dr. Scott Ackerman, one of the First Coast leading oncologists, he joins us every week to talk about important health issues such as this. And today he brought along a special guest with him. Thank you so much for being here, Dr. Ackerman.
Casey.
And who did you bring with you?
So I brought a good friend of mine. We work a lot together. His name is Steve Buckley. And Dr. Buckley is a gynecologic oncologist. And a gynecologic oncologist is that specialty of oncology that focuses on the female reproductive organs and those malignancies associated with the female reproductive organs. That's what Dr. Buckley does.
And Dr. Buckley, good to see you again.
Good to see you, Casey.
So let's dive into this first to you, Dr. Ackerman, and talk about hormone replacement therapy and what it is and why someone would decide to go down this road.
So a lot of women, as they get older and go through menopause, their levels of estrogen go down. So a lot of women look towards hormone replacement therapy to treat some of the common symptoms of menopause after they've tried maybe some other remedies. The symptoms of hot flashes and lack of energy and those sort of
All
things.
the great things that come with being a woman. Yeah.
Exactly.
Thanks for
when
that.
you're young, but as you get older
Yes.
and your hormone levels go down, women look to using female hormones like estrogen or progesterone to replace those hormones that the body no longer makes.
Right. So we need estrogen in our bodies. And why is it that our bodies need this? Why is it so important to our well-being?
Well, first of all, not every woman needs estrogen. Okay. Now, of course, premenopausal women, estrogen is essential for reproductive health. But in postmenopausal women, it's really those women who, it may be used for women who have those symptoms that Dr. Ackerman talked about, the hot flashes, vaginal dryness, sometimes mood swings associated with menopausal symptoms. It's important to note, too, though, that in the past, hormone replacement was given for the prevention of chronic disease. That was in the past. No longer is that the case. Estrogen is not indicated for the prevention of things like heart disease, osteoporosis. It's really for the symptoms of menopause.
Okay, and is there one type of hormone replacement therapy, or there are multiple options? Because you see these a lot. You see a lot of advertisements for hormone replacement therapy, and I'm thinking it's like a one-size-fits-all kind of thing.
Well, there again, it used to be a one-size-fits-all, and there's really many types of hormone replacement. There's the conventional doses of estrogen and progestin that we typically have prescribed. And then again, more recently, bioidentical hormones where physicians are attempting to match the women's physiologic state, and then there's many different routes to give it, by mouth, creams or lotions, skin patches.
All of this is safe?
Well, and that's the key. I mean, there have been large studies looking at the safety of estrogen replacement therapy. Typically, with the standard doses of estrogen. Sure. And what these studies find is that women should try to limit their use of estrogen to probably no more than 5 years, if possible.
Well, that was going to be my next question. Yeah. Is this something that you would have to stay on for a prolonged period of time, or is it just till you feel better and then you come off of it?
Well, I think that, in the past, again, we used to put women on estrogen. We'd say, honey, you're going to be on that for the rest of your life. And that's no longer the case. I mean, looking at these studies, the main risk with estrogen replacement is the potential increased risk of breast cancer. But what most experts say is that for the average younger postmenopausal woman between ages 50 and 59, really it's very safe for use up to 5 years in that case.
Dr. Ackerman, let's bring you into the conversation here as we close things out and talking about the risks that women should consider before taking this kind of therapy. And you had just mentioned, Dr. Buckley, the breast cancer risk.
So these drugs are very good because they make you feel better, they eliminate the mood swings and the hot flashes, but there's risks associated with them. And I see in my practice as a radiation oncologist, I see patients with uterine cancer and breast cancer, and many of those patients have receptors on those tumors that have shown us that they were moved along, or they were
not necessarily caused by.
Not really caused by, but maybe they had this cancer earlier than they would have otherwise because of the fact they took estrogen. But there's other diseases too, like deep vein thromboses, blood clots in the legs, pulmonary embolisms, uterine breast cancer, as I mentioned, and heart disease that are all potential problems with taking hormone replacement therapy for too long a period of time. So what I recommend to women that talk to me is to weigh the risks and benefits, discuss it with your physician and determine what's the best option for you.
Yeah, discuss with your physician first before just jumping into something. Good
Absolutely.
advice. Thank you so much for being here. And Dr. Buckley, good to see you again. And Dr. Ackerman, as always, we appreciate seeing you every Thursday for sponsoring this segment. And remember, if you have any questions for Dr. Ackerman or you have any other health questions that you might have, you can visit Dr. Ackerman's Facebook page, which is facebook.com/Ackerman Cancer Center.